Hello, everyone. I'm Wanda King, Chairman for the Women's Healthcare and Wellness for Alpha Kappa Alpha Sorority Incorporated Beta Pi Omega chapter. I also have with me here today LaShawn Kelly, who's our co-chair for the Women's Healthcare and Wellness Committee. We would like to share with you some important information regarding COVID-19 today. We have one of our very own sorority members today, Dr. Creshelle Nash, that's here to help us explain some COVID-19 questions and answers. She is a MD here in the Central Arkansas area, and I'll begin by giving you a little bit of information about Dr. Nash. Dr. Creshelle Nash, MD, MHP, is a medical director at Arkansas Blue Cross and Blue Shield. She has an extensive history that combines clinical practice, health policy, public health practice, and health plan leadership. Her past work includes assistant professor, Department of Health Policy Management, and assistant professor, Division of General Internal Medicine, University of Arkansas for Medical Sciences here in Little Rock, Arkansas, where she spent 15 years in clinical practice and 4 years as medical director for the Arkansas Minority Health Commission. Dr. Nash's primary interest is in clinical practice and the translation of research into viable programs and policies to improve the health of populations. Dr. Nash has taught health policy and assisted in informing health policy decision makers through research with the Arkansas Minority Health Commission. And she worked with the state legislature, Arkansas Department of Health, and community-based organizations. She has also worked on the development of an inaugural faculty of both the Fay W. Bozeman College of Public Health and the Clinton School of Public Service. Dr. Nash received her medical degree from the University of Maryland at Baltimore School of Medicine in 1994 and completed a residency in primary care internal medicine at George Washington University Hospital in Washington, D.C. in 1997. She was a 1997-98 Commonwealth Fund Harvard University Fellow in Minority Health Policy and received a Master's in Public Health from the Harvard School of Public Health in 1998. Most importantly, she is a daughter, a sister, an aunt, a community advocate, and a servant. Welcome, Dr. Creshelle Nash.
Thank you.
Dr. Nash, we are so excited to have you today, and thank you for taking time out of your busy schedule to help us inform our community about COVID-19. We appreciate your expertise, and I know our viewers will appreciate an accurate answer to what this disease is. So let's start out right there. What is COVID-19?
COVID-19 is a viral illness caused by a coronavirus. It's a new virus in our population, and that's why you see it spreading so quickly all across the world.
Okay. What are the symptoms of COVID-19?
The symptoms of COVID-19 are very nebulous sometimes. It's an upper respiratory infection, like a cold or a flu. It can start like that, upper respiratory. But what makes this disease difficult is that it tends to be more severe, but you can have fever, aches and pains, cough, a dry cough. That sounds very much like the flu, right?
Yes, yes, it does.
It's a coronavirus. But the interesting thing and the difficult thing about this virus is that it can be very severe and go from the upper respiratory tract down lower into your lungs. We call that the lower respiratory tract, and cause an overwhelming infection and pneumonia.
Okay. How are people being treated for COVID-19?
So right now, as you have probably seen in the media, there is no treatment specific to COVID-19. When somebody is sick, we are trying to support them, to support their bodies so that their bodies fight it off. Because right now, we do not have a treatment. We do not have a vaccine. Everybody's trying to figure out what works, especially in the most severe cases.
Mhm.
A majority of people, though, will just probably get over this. 80% of people, we think, will have mild symptoms or not severe symptoms, if that makes sense.
Okay. What should I know about COVID-19 regarding my health insurance? Does COVID-19 testing cost me anything? And if it does, how much does it cost? Many people are concerned and maybe they're not being tested because they don't have the money or feel their insurance company won't pay for the testing.
So, as you all know, insurance can be very, very confusing, even for
Yes,
healthcare providers, okay, or people who work inside health plans.
yes.
What I can say is that for the major ones in the state of Arkansas, everybody is covering treatment and testing for COVID-19 without any cost share. And what that means is there should not be any copay or any deductibles for treatments that are related to COVID-19.
That's awesome.
Now, the interesting thing, though, is every insurance is different, right? If it's coming from your health plan, from your employer, because your employer can do what they want to do. So the best thing for you to do to get your question specifically answered is either call customer service on the back of your health insurance card, and they should be able to tell you, or go on the website. And everybody has, the major players that I looked up are all doing the same thing to try to make sure that there are not barriers to people getting care. Everything from no copays to telemedicine, to being able to get your prescriptions early or extended supplies and things like that.
Well, Dr. Nash, I heard on the governor's town hall that he's encouraging the public to be tested in the next few days because there's an abundance of testing now, and he's encouraging those that have the symptoms to be tested in the next few days. Is that accurate?
Yes, he has made that announcement, and I think testing is important, but we have a long way to go in being able to provide the number of tests that we need all across the state of Arkansas. He has a goal of 1,600 tests a day. We have 3 million people in the state of Arkansas. So it's very important with the limited number of tests that we have that those at a high risk are tested, healthcare workers are tested, people who have symptoms are tested. I would just say if you're just worried well, let's let other people get tested first. But there are definitely options here in the state of Arkansas with the health department, with UAMS, and with the local private lab companies to get tested for COVID-19.
Dr. Nash, that brings up a really good point. Many people are afraid right now to go to the doctor's office. They are running out of medications. They're concerned about refills. Are there other options for people to see their doctor? And if so, how does that work without physically going in?
This crisis has really brought on the technology side of medicine very, very rapidly. So I work with a lot of providers also who are ramping up to do telemedicine. So actually you can visit your provider either telephonically, calling them on the phone, or with your cell phone through Zoom or chat or whatever. And a lot of private physicians are ramping that up. So those are options of seeing your provider without physically going in. But I would say that if you are in an emergency situation where you need help, you should not delay going to the hospital. I've seen some reports of people having chest pain or stroke and not going to the hospital. That is a mistake. Those chronic diseases still go on, right? People still get sick outside of COVID-19. So we really, especially in our communities, because we delay care for a number of reasons. But if you have a concern like have chest pain or shortness of breath or slurred speech, facial droop, arm weakness, those are signs and symptoms of either a clot in the blood vessels around your heart or a clot in your brain. Time is of the essence in those situations. Still call MIMS, emergency services. You need to get care.
Another question, Dr. Nash, that we've had is that we see a lot of people wearing masks in public. Should I be wearing a mask when I'm out in public? And if so, why? Some people feel that they're hot and that they're bothersome, or maybe that they look weird on, they mess up my image, I'm cute and I don't want to wear one, or I'm handsome and if I wear one, it ruins my image.
Well, let me say, you can show your style and your image through a mask.
Yes.
Exactly. Being very creative these days. Now, let me say that the only constant in this epidemic is that things are constantly changing because we're learning on a day-to-day basis, okay? So part of the confusion in this is that the guidance has changed over time because we're learning more. So when I go out of the house, I wear a mask. Why do I wear a mask? I wear a mask because while it does not prevent the virus from coming in, if I have symptoms, cold, sneezing, it keeps the virus closer to me so that I don't spread it to other people. That's number one. Number two, it allows me or reminds me not to touch my face. Another way that this virus can be transmitted is if it lands on a surface and you touch it and then you touch your face and it gets in through your nose, your mouth, your eyes. So that barrier there reminds you not to do that. I think that because we don't have any treatments right now besides supportive, the best way we can protect ourselves is prevention. And not only ourselves personally, but our communities and our families. So I would recommend that we wear masks. Now, for healthcare providers, they have special masks, which you've seen, that decrease that can block the virus. Those are the N95 masks. But everybody walking around the street doesn't need that. We need social distancing. We need to wear masks because we need to decrease the transmission rate of this virus.
Awesome. And I wear masks too. I just wanted to clear that. Matter of fact, I have my mask here with me today. I just, for purposes of our discussion, I didn't put it on.
Because we're further than 6 feet apart.
Yes, we are. We are.
All right.
So in addition to the mask and the protective barriers that you've already discussed, the social distancing, we're hearing things about medications to take, supplements, superfoods. Are there any remedies that you are aware of that would help prevent us from getting COVID-19?
Let me say right now, the best protection is prevention.
Mm-hmm.
There's no superfood, there is no remedy. There are lots of people out there selling snake oil right now. Right? There is ongoing research to try to figure out what's going on, but I would say before you take anything that you learn about off of social media, regular media, whatever, consult your physician or a healthcare provider because it can be dangerous and it can be life-threatening. For example, let me just state, please do not drink, ingest disinfectants. That will be harmful to your body, to your kidneys, to your heart, potentially to your liver. Do not do that.
Great. Another question is, there are a lot of rumors out there that African Americans cannot get COVID-19. Who's at highest risk of getting the virus and becoming seriously ill? What group of people are at the highest risk?
We are still, again, learning about this virus on a day-to-day basis. And as you know from my background, my passion and what I care about is underserved communities and how we make sure those in the most need get the care that they need. So when this virus first started out, we thought, and we were told, that it was people with chronic conditions, yes, and chronic conditions can be things like high blood pressure, diabetes, lung disease, smokers, kidney disease. There's lots of that in our community, right?
Mhm.
Over the age of 65, and people who also have suppressed immune systems. Now, early on, that gave young people really a false sense of security out there, I think. But then as this virus has moved on, we have seen otherwise healthy people, right, succumbing to this disease. So in my mind, everybody is at risk, but then I need to add minority communities. I need to add homeless people. If you don't have a home, you can't shelter in place. We know that people in nursing homes, we know that people who are incarcerated, large numbers of people in small areas are at increased risk. So all of us have some sort of risk factor. So that's why it's really true that we're all in this together. And we really need to make sure that we're doing everything that we can to protect our communities.
That's great advice, Dr. Nash, and we appreciate you dispelling some of the rumors here today, because there are a lot of them out there, that's for sure. And we would like to add, are there any other, anything else, any other advice, anything else you would like to give to the community during this COVID-19 pandemic? Anything that we've not already discussed? Any advice that you would like to give to the community today?
I think I would like to add that we need to make sure that we take care of ourselves physically, mentally, and spiritually through this crisis. This is not a sprint, right? People are throwing out random dates of when this will be over. We don't know. We don't know. This is a marathon. I would say also get your information from a credible source. Don't react to one news story or one study that comes out, but the overall evidence.
Well, thank you so much, Dr. Nash, for your time today. We appreciate it. It's been very informative. Like you said, this is ongoing. Every day there's something new. How would our viewers reach out to you if they needed more information, if they have a question that hasn't been submitted? How can they get in touch with you?
They can get in touch with me by email, and it is Creshelle, CRESHELLEN50 @gmail.com. Please feel free to send me your questions. And we just want to make sure that we are providing credible, consistent information, not rumor, not scare, but have our communities understand what we're dealing with.
We have one final question to come up, Dr. Nash, and that is, what if I'm not feeling well and I'm not sure I have COVID-19? What should I do?
That's a very good question. Because we have a lot of things going on with, this is flu season, this is allergy season, right? So every time I get a scratchy throat, I think, oh my goodness. So my first thing to say to you is, first, don't panic, okay? Do not panic. Most people get better within 14 days, all right? But if you are concerned, you need to, if you can, separate yourself from the rest of your family, all right, if you can, and put a mask on yourself, all right, because If you do have the virus, it decreases you spreading it to everyone else like we talked about. If you can also, in your home, use a different bathroom if you have more than one bathroom, or do cleaning of common surfaces. The other thing you need to do is watch for your symptoms, right? Oftentimes people have these flu-type symptoms and they get better after a couple of days or after a week. If you start to get worse, having shortness of breath, right? And when I say shortness of breath, what I mean is you have problems getting air in with your normal activities, right? You have increased confusion. You have problems speaking full sentences because you're so short of breath. That's a problem. You need to call your provider and you need to get in to be seen, all right, to the hospital. So what you're doing really is treating the symptoms, making sure you stay hydrated, sleeping and eating and all of those good things, separating yourself from your family and watching for those worrisome signs. Those worrisome signs: increasing shortness of breath, confusion, just not getting better. Then you go in. Does that make sense?
Yes, that makes a lot of sense, and that's common sense. That is, but sometimes I think, given a crisis like this, a pandemic like this, I think we forget some of the common things that we already know, but we need to be reminded.
Exactly.
Thank you so much, Dr. Nash, for our segment today. On behalf of Alpha Kappa Alpha Sorority Incorporated, Beta Pi Omega Chapter, Target 2, Women's Healthcare and Wellness Committee, we would like to thank you again for your information and your time today. Thank you.
Thank you.
Thank you. Be safe.